So while the early treatment is a cornerstone of the management of the disease, you are right, we hope to identify before the start of the disease, are able to capture the true onset, biological onset of the disease, and then introduce a drug even earliest, so to foster toward very early introduction of the treatment. And one of the next steps could be the identification of disease-modifying therapies effective against progression, against neurodegeneration. If we are able to improve our knowledge about the pathogenic mechanism of PIRA and progression, maybe we could identify effective treatments for these mechanisms and go towards a more precise and personalized medicine. And unfortunately, there is no therapy effective on the purely progressive phases of the disease. Coming back to the definition of PIRA, at the end of the session, one question raised the importance to extend our assessment beyond the expanded disability status scale alone, including that is highly biased towards motor dysfunction, but we have also to consider cognition and other measures such as patient-reported outcomes, and importantly also data from MRI. So all these data should be included in our definition of PIRA in order to identify true progression, true pure progression, and extend our knowledge on the disease. All the hidden symptoms must be highlighted in the management of the disease. As for cognition, now all the neurologists are aware that cognition is an important core feature of the disease, and a feature that is already detectable in the earliest phases. So in general, a baseline evaluation of the neuropsychological function is quite available. One of the main challenges is to identify the change of the performance, a meaningful change of the performance. We have a test, a neuropsychological test. We must be able to identify a significant change between the score, the difference in the score between time 2 and time 1. We are not sure that a change can be considered as significant. So we are providing data from the healthy population and trying to provide formulas and other calculation in order to be able to capture a clinically meaningful change of cognition. It is crucial to identify progression. I am excited to participate in this Congress because it's a great advance for the research of the disease. It's a great opportunity to create connection networks all over the world, and this is fundamental for achieve further success in the management of the disease and the understanding of pathogenic mechanisms.